Hello everyone. So today I'll be teaching you guys how to circulate a XI robotic surgical case. And so I have provided handouts for you and there should be enough space up there for you guys to take notes. And if you need to, you can take notes on the back if you need to. So let's get started. So here are the objectives. I won't read them out loud, but they are provided to you on the handouts that's in front of you. So you'll know what all I'm expecting you to know or what all you will learn from this lecture. So here are my goals for you. This is also provided on the handout in front of you, so I won't read them verbatim. And so let's get into quick need to know pointers. So as nurses, you guys already circulate in the OR with me. And so preference card and pick list shouldn't be new to you. However, I will have a picture of a XI robot preference card, and this gonna follow this slide. And so, with the preference card with the robot, it's important to make sure you have everything, even if it's something that the surgeon wants available. You need to have that in the room due to all our robot supplies and instrumentation is downstairs in CSP. So the doctors in those type of rooms, they don't want to wait too long for things, and sometimes CSP will take a long time. So you need to make sure you have all available and open items in the room and ready. So if the surgeon say they need it, you're able to open it up fairly quickly. And everyone know about case carts. So case carts are these metal carriers that's going to hold all of your supplies. And I do have a picture of that as well. And the sterile field, as you know, because you're not new to circulating in the OR, the sterile field is anything that's blue. And this is the same thing that goes for robotic cases. Anything that's blue, you do not touch it because you will contaminate the field. And also, while we're talking about keeping things sterile, with the robotic cases, there will come a scope in this blue wrapping. Once you hand the scope to the tech, your job is to hold that blue wrapping up to the ceiling so that you can make sure there's no holes or even small penetrations in that blue wrapping. Because if there are, that means that that scope is contaminated and you will need to get a new scope. And also, you will need to know how to troubleshoot the robot. Now, some of these things you're able to fix on your own, but if not, you may have to escalate it up. So, if they're saying that they need the smoke evacuator on, this is on the XI robot tower. And so, you will see a small button up there that has insufflation. You'll click that and you'll turn it on. So some of the problems that happen during XR robotic cases, the nurse can fix on their own. Like I remember there was a time where the Bovie wasn't working. So sometimes you may have to unplug it and plug it back in. Those are the little things that you can do. But sometimes you may have something where you have to escalate it to a nurse manager. So even if it's something small and you feel like you can't do it, you could always escalate it up to a nurse manager, charge nurse, and if they can't fix it, y'all can escalate it up to the XI company, which they have a 24/7 customer service line for you. So this is the pick list for the robotic card. And so this looked just like any other pick list that we have in the OR. And so I wasn't able to put all the pages of the preference card for our XI robotic case up here due to there being surgeons' names on it, and I want to make sure to keep everybody names that work where I work confidential and private. And these are the case cards for the robotic procedure. So as you can see, this is the scope that I was telling you about that has that blue wrapping that you will have to make sure that it's not contaminated. And these are the trays for the XI robot. And so you can see that this is the striker camera set, and this is the XI robotic pan, and so forth. And so, like just like any other case, you'll have to make sure, like once you open the pan, there's going to be this blue film in it. You're going to have to make sure that that film doesn't have holes in it and that the bottom of the tray is not wet, because that means contamination. But we all know that. But this is just to show you how the XI robot case card is no different from the case cards that you've used in other types of cases. And so this is your room setup for XI robot case. And so, like you see in your other rooms, you have all your supplies on the bed, your pack is on the table back there. This is the XI robot that you will be working, and this is where the scope is placed so that you can open it for the surgical tech. And this is the tower where you will be plugging in your Bovie, your insufflation tubing, and on this screen is where you will turn the insufflation tubing on to high flow or low flow, whatever the surgeon wants you to do. Similar to how you'll do this tower is similar to how you do with laparoscopic cases with the Stryker tower. Okay, so XI robot preparation. So when you come in to your robot, you'll see your items on the bed if this is the beginning of the day. And so you'll open all your supplies, make sure your sheets are the appropriate length for tucking the arms, because on robotic cases you always tuck arms due to the robot having to come in and get close to the patient so it can get positioned correctly enough so that it can work in the area that it needs to work. So it's important to have the bed positioned correctly, and also to have everything in the room, including the robot, situated correctly to make it easier for you to drive the robot up to the bed where the patient will be lying. So once the bed and packs are open, you want to go ahead and count with your surgical tech. You want to go ahead and put local on the field. You want to go ahead and write the patient name, date of birth, allergies, the surgery type on the board. And if it's a female that's under the age of 50, you want to make sure that you have an HCG and a typing screen. Now, if that patient have had a tubal or even a hysterectomy, you may not need that. But you want to make sure you've counted and you have everything that you need in the room before you go to pre-op to check your patient in. And this is all what that screen is talking to you about. Do anybody have any questions so far? Okay, let's move on. So once the patient roll in the room, you will have to move that patient to the OR table. So it's important that you make sure you have enough people to move this patient safely. And once you move the patient safely, you want to strap them in and get ready for induction. So you'll have to do a timeout for the induction. And this, everyone knows how it looks. I do have a picture of the anesthesia timeout as well as the pre timeout for the surgery. And I will show that close to the end of the lecture. And so once the patient have been intubated, you want to go ahead and start prepping the patient for surgery. Always, always, always place a Foley because it's needed for robotic cases. It doesn't matter what type of robotic case it is, and it doesn't matter how quick the surgeon can finish it. So you want to make sure you place a Foley, and you want to make sure you prep the belly with ChloraPrep. If it's an open wound, we know to use betadine. And once you have prepped and the surgical tech has draped, it's time to call the surgeon so the surgery can be started. I'm sorry. Okay, so these are the different positionings that can be used for the robot. However, the only position that I've seen is lithotomy, and that's for GYN cases, and supine, and that's for general robotic cases. I have seen lateral, and that's usually for esophagectomy cases, but it's kind of like a lazy lateral that's done for those cases. Okay, and this is the anesthesia timeout that I was telling you about. And then I'm also showing you the pre-procedure timeout as well. And so the pre-procedure timeout, this is what you'll say once the surgery is in his gown and gloves and at the field. You want to say, freeze, all eyes on me. and you want to go in order by the order that's on this board right here. And so, after you do your timeout, you want to make sure that once you've put the insufflation tubing and the Bovie tubing in, you want to make sure you get the surgeon situated, because he's going to ask you to turn the gas on. When he say turn the gas on, you ask him low flow or high flow, and then you adjust it according to how he wants it. Once you have him situated and he's trying to put the trocars in, this is your time to set up the robot. And so this is the guide that you'll use to set up the robot. And on the screen, it's going to ask you what side of the patient you're going to put it to, and what anatomy of the patient, what area of the patient will you be working on. And this is what this little guide is telling you. And so, this is something that I was telling you, what I already was talking about, how you do freeze, all eyes on me. And then, once the surgeon get the trocars in, he's gonna say, okay, Dr. Robot. And so this is your time to drive the robot up to the patient. And so once you drive the robot up to the patient, the surgeon will indicate how to turn the robot, whether you're gonna turn it right or left. And what you'll do is there's this little controller that's shaped like a circle. You'll turn it whichever way that the surgeon wants you to turn, and this is gonna turn the arms of the robot in the direction that the surgeon needs for it to go. And so once it's a position, once you have positioned the robot to the way that they want it, they're gonna place the arms onto the trocar, and then this is where the surgeon will sit at the robotic machine, and he'll start working on the patient. Even though that this is a robotic case, you have to be listening, because they're gonna be talking to you and communicating to you about different things. So you need to make sure that you're listening as you're documenting, and also while you're listening and documenting, you need to be watching the sterile field to make sure the field is not getting contaminated. And once the surgeon is done, he'll tell you to undock the robot. And so all you're going to do is, once they have completely removed the robot from attaching to the trocars, you're going to drive the robot back. But do not drive the robot back until they have cleared you to do so, because you can injure the patient if you move it back too early. And so once you move the robot back, this is when the surgeon will start closing. You want to go ahead and start doing the count. So you'll do your second count with your surgical tech. And so while he's closing, you want to make sure you are kind of organizing your room, because it depends on if you have another robotic case after. You want to make sure you are efficient and using your time wisely, so that it won't take you long to turn over your room for the next case. And so, also you want to go ahead and ask the surgeon at this moment, what type of dressing do you want? Sometimes they deviate from their card. So before you open anything like skin fix or anything like that, you want to make sure you ask them, hey, doctor such and such, do you want skin and fix for the dressing? And if he say yes, you go ahead and open it to the field. And then once that's over with, before he stitch up the last port site that he used, you want to do your final count. And from here, the surgeon will put the skin fix on, and then he will exit out the room. But before he exits out the room, a post-operative timeout is a must that you have to do, so that you know what was the post-op diagnosis after the surgery was done. Most surgeons are good at telling you, okay, pre-op diagnosis, post-op diagnosis, EBL, but some of them they do need a little reminder that you need to know these things before they leave the room. And so now it is your turn. On the mannequins provided, I want you to demonstrate how to properly position a patient in the following positions: supine, lithotomy, and lateral. It can be left or right. And then after that, you will need to demonstrate how to prep the patient in supine and lithotomy position. So everyone get in groups and let's get started. Okay, so I hope you guys learned something from this. And if you have any questions, you can always contact me. I am here to help and available to assist you guys with the prepping and positioning. And I hope you guys learned a lot today. Thank you.